Bismillahirrahmanirrahim.
Interesting question. What should a parent do if through a scan during pregnancy the doctors tell them that the pregnancy should be terminated due to severe abnormalities?
My answer up till now has been, if the problem of the fetus, leave it till it's come by itself, If there's life threatening for the woman, you may end the pregnancy.
That's a related question to this person. What should a pharmacist or a doctor do if a person wants to take the morning after pill? Now this is a pill that after making love you can terminate the...
Yes, I understand. Okay. According to the non-Hanafi, it's haram. According to Hanafi, since the ma'asiyah or the sin is not committed by the pills themselves, it's makruh tanzih, as I said before. Okay, Hanafi makruh tanzih. The others, it's haram.
We have several doctors out here today. Any particular ayat from the Qur'an or dua for doctors to read to allow them to provide shifa by the will of Allah? So for our patients, would you maybe give us some links or?
The best thing, to keep your heart connected to Allah subhanahu wa ta'ala. But I'm going to tell you about some experience, okay? I was in US, and a relative of my brother, I used to live in my brother's house before marriage, One of his relatives came, and he said, why you don't get specialized in surgery, I'm a surgeon and I have a jinni to help me, to make the surgery. Okay. Some they seek this help. We have other physician and other person, when they have good relation with the angel next to them, they are going to have to find the most accurate decision, at the time it's needed for. Okay, the Prophet ﷺ said about malakun yusaddidu. Okay, you need this not only for your profession, you need it for all aspects of life. You need that malak who is going to be next to you and give you the good advice about what you should do. And this is by having good relation with that particular angel.
Okay, next question. Are you allowed to give or take organs? And related to that, are you allowed to donate body parts when you've died?
I had long study about it done perhaps 20 years ago or 18 years ago. Again, if I said yes or no, don't believe me. I need more deeper matters. What I came at the end that it may be permitted, it was two exceptions. The brain transplant, if it's available, to best of my knowledge, not available up till now, and testicular transplant. The other organ transplant will be permitted, inshallah.
I think this is an interesting question. Post-operatively, so after an operation, can any tissue be used for research or educational purposes?
Again, to start with, any portion of your body should be buried, unless there's a necessity or high need, it may be used, for stuff.
If a Muslim physician knows a risk during treatment, for example, amputation due to infection, and then subsequently death occurs, would there be any consequences for this Muslim physician?
If there's any negligence, yes, he is responsible. If there's no negligence, no, he is not responsible.
We have two questions, similar themes about natural and holistic medication, mainly plant-based medicines, aromatherapy, cannabis oils, smoking pure marijuana, these sort of things. What is the Islamic perspective on these?
I'm not that good expert, about them, but anything which is beneficial, we have the rule I read, here you weigh the advantages and disadvantages of these things, and you go by them, okay? If this is not going to cause much more harmful matter, always we weigh the advantages and disadvantages. This a rule, was put for me here, and I did it.
someone said, someone is quite interested in what did Sayyid ibn Jabr say after they died. And then
He did not, no, Sayyidina Zayd ibn Jabir, not Jabir. Jabir, he passed out and was visited by the Prophet and Sayyidina Abu Bakr, and he made wudu, he made wudu and sprinkled the wudu on him, and he woke up, and asked the Prophet a question, and then the revelation come, and he lived after a long life, when he was old when he passed away. Zayd ibn Jari, when he said, La ilaha illallah Muhammadur Rasulullah, Abu Bakr as-Siddiq, Umar al-Khattab, Uthman al-Shahid. That's what he said after this.
There's a person out here who wants to have a bit more information as to what actually happens to the body when it's been taken abroad. Because obviously, a lot of us here of Pakistani origin and quite keen to take our
I think what I have heard, correct me, I may be wrong, because one of our physicians, his boy died there, and I was there, and they said internationally you cannot move the body from one country to another without emptying anything, everything in the belly should be emptied, And I think this is what applicable here, and I have heard something about this, from the people here. So if this is the case, I look at it as prohibited. Okay? I cannot, this is haram to be done, okay? And by this, it's not a must to be buried in Pakistan or in Syria or in Saudi Arabia. If I'm buried here, this is the land of Allah. All lands, they belong to Allah. Yeah. And to be more highlighting this point, you love to live here, okay? So use the soil of that land,
Someone's just written, just to clarify, is it permissible for a Muslim physician to sign the cremation form under the Hanafi madhab? And the second point I'd like to mention is the fee attached to that gets
okay, again, in Hanafi madhab, again, I have a lot of concern. I haven't come to definite answer for it. I look at it in this possibility that in Hanafi it's not permitted. I did not say permitted. Don't miss. I said makruh tanzih. That's mean no sin action there. It's makruh tanzih. How do I deal by it? Whenever there's any possibility to run away from it, run away from it. Okay, this is the meaning of makruh tanzih in my view. Okay, when they give money, it's okay to take it.
Okay. That's probably a quick one here. Are you allowed to pray with your catheter on? So this is the YouTube.
Well, the other solution, to take it out, no. Islam is very simple, okay? You are going to be considered as ma'zur, okay? And this is your answer. Ma'zur, namely, that problem of urine coming out is not considered as a break of his wudu, yet he should, according to Hanafi, to make wudu whenever the time is over. Okay, whenever any time is over, you renew your wudu. And the other breaks of wudu, they're still there. Okay, but this break of wudu has been taken away, and the time change is considered as a break of that particular excuse, than the original one. But don't take the catheter out, because you are going to create a lot of problems.
We've got lots of repetition here. I think most of these questions have been answered. Interesting one. Can a Muslim doctor go to a politically conflicted country and treat patients? So what's your recommendations there?
It depends upon his intention. Why did he go? Okay? إنما الأعمال بالنيات.
Couple more of this. I think we've done well to cover most of these questions. See if there's any more. So what is the adab of a practitioner to their patient?
Very good question, I think. I studied medicine in Syria. Then I worked in Saudi Arabia. What was brought to my attention, many of those regulations, as physician, we don't practice it. You are going to find the one who is a ventilator, without any clauses, and everything is manifested or whatever. This is not the Islamic way. as a physician, as a Muslim physician, you may do something, to cover, even for the non-Muslim, cover his aura, okay? For Muslims, make some partition, between males and females and whatever. Really, this is the first note that I have when I moved to Saudi Arabia, that the practice there, even though medically, it's very good, medically, much better than Syria nowadays, okay? But the practice Islamically, it amazed me because you have some consideration about it. Well, my advice to all of you, okay, whenever it's applicable and possible to practice some of your Islamic regulation, do it. Don't say, it has been going on like this, for 100, I'm not going to change. Don't change anything, okay? But whenever you come to any case, that you have something to do, do it. Keep it in your mind all the time that we are deficient. We as Muslims, we are deficient, in practicing this protection that has been instructed to us from Allah subhanahu wa ta'ala, and whenever it's possible, please do it. And the physicians per se, they are highly respected, in the societies, usually their word is going to be accepted.
Is there a similar way of breaking bad news?
Yeah, for sure, Some of those bad news, they kill the person who received them, So perhaps you don't face it here, but back in our countries, we may face this problem. So that's why you should use your wisdom, in this, okay? And what is applicable for so and so may not be applicable to the other person, Here you should use your wisdom about knowing the personality of this person and the other person. I had this experience, in US, even though I'm not that fluent, in English, they asked me to tell that person that he has cancer. And it was too tough on me. It was one of my first experience, And he took it very easily. He said, okay, so what, 100 years ago I was not here, and 100 years after I'm not going to be here. But this is not the response or the reply of everyone. That's why you should use your wisdom.
Jazakallah. What are your views on immunization of children? Because obviously some of these vaccines have elements of pork and other sort of products.
When it's highly needed, for protection, and as I said about protective measurement, in Islam, it may be used, but whenever we have a substitute of it, nowadays, when we first graduated, the insulin was coming from the pork, then they have the human insulin, humulin or whatever, and whenever you have a substitute, you shouldn't go by it.
Question from a female member of the audience regarding periods. This lady has irregular periods, and as a result, her prayer has been affected. What would your advice be regarding the prayer and the irregularity of her periods?
By Hanafi is too difficult. Okay, this is not medical question. Some may think that it's medical. Okay, you are not obliged as a Muslim to go to the doctor and ask him, is this period or not? Okay, for the month of Ramadan, you are not obliged to be precise, about the beginning of the month. The months begin when you start fasting. This is what the Prophet ﷺ said. Okay, you do your best, to figure out when is the start. When it came that you are wrong, so what? This doesn't mean anything. The month started, and here just look at Islam as a simple way. Okay, not complicated way. You are not obliged to go to the physician, to ask him, is this a period or not? You should use your skill in that. Okay? In Hanafi, I found it difficult. I go by the Shafi'i opinion, of recognition. Okay, in Shafi'i opinion, there's a recognition, and most women they have the full recognition between the period per se and the bleeding. If it did not work for you, then we should have it resolved individually, because we have other solutions in Hanbali method.
An interesting one for the doctors here. If a male baby is circumcised, but the practitioner has not fully removed the foreskin, and now the male is an adult, should he get it properly done?
Yeah, he should get it properly done. And it happened to 2 of my children.
Right.
Yeah, you feel ourselves that we are perfect, but apparently the elderly, they were much better, I have 5 besides me, we are 6 brothers, never happened to any of us, of this problem, but it happened to 2 of my children.
But a question here regarding sort of psychiatric issues and disorders. Someone's mentioned here, can dhikr and salah be an effective way of treating that as opposed to medication?
I have full belief in it, even though I'm not an expert, okay? As a physician, I think you should work hard in your field, okay, and try to find the best medical treatment to that particular person, from your side, But I think it's a good idea to have some help, from the other sides, in this regard. I'm not that good expert in it.
Okay. I think there's been a couple of people asking about the prophetic medicine, and I know you said you were mainly here in terms of discussing the modern medicine, but is there any particular area you would highlight that is of really good use? I mean, someone's written something about hijama for sort of chronic conditions. Do you have much experience in regards to
No, I'm sorry. To be honest with you, and this one of my many deficiencies, that I did not apply the prophetic medicine to my medical, life, the way it should be applied, I was asked in US, to give a lecture, about prophetic medicine, and really it impressed me a lot, in the protective measurement, much more than the others, But all the others, they are really great. And some of the shuyukh, they said, whatever you take it from the Prophet ﷺ as for guarantee is going to cure you.
Reproductive question here. A partner's sperm is frozen. Can that be used in the future after he's died?
According to Hanafi mazhab, when the death happen, if the dead is the woman, that means the contract interrupted right at this. If the dead is the man, the interruption is going to take place after the iddah. And by this, nothing of these materials or particles could be used after that.
Okay. Don't know where the question's gone, but there was something about ultrasounds and CT scans in terms of aura. For example, when a woman is pregnant, she puts it on Facebook that look at my baby. But what's the Islamic viewpoint in terms of
Islamic viewpoint that kashf al-awra is going to be just for necessity. And you reminded me that I was seeking fiqh knowledge, from Shaykh Abd Allah Siraj, and this question of IVF came to him, at that time. And he said, the procedure itself is permitted, but kashf al-awra is haram. Because he did not feel that to have a baby is a necessity. Okay? Why I'm bringing you this issue, because we tend to be more flexible and more free in this matter, And really he amazed me about how quick and how precise was his answer to that question.
You may have answered this question, abortion of a baby from rape.
No, this is completely prohibited. We haven't answered it. This is completely prohibited. The one may have criminal, if it's rape, there's no criminal from the female side, but to kill that, this baby doesn't belong to me or you, okay, so no one has the authority, to kill that baby. No, this is completely prohibited.
Fine. And someone's got a bit of a dilemma here. This person's father has requested that his body be taken back after his death. As his children, should we disregard his request?
Yes, for sure. And whenever you have any will, which contradict with any Islamic regulation, especially the prohibited things, we shouldn't fulfill that will, and this is my view to it, If you have a way of taking the body without having this opening or whatever, then it's different story.
So I think someone wanted clarification of a point you made earlier. If someone is brainstem dead, and they've been told we should not switch off the machine, but if the machine is pumping blood and breathing for them, will that not keep them alive indefinitely until the machine is switched off?
To the best of my knowledge, if they are brain dead, no, because we used to use for this patient, a lot of medication to keep up their blood pressure, and eventually this will be the main cause of death, So when you don't go give this supportive treatment, or you don't give IV, as I said before, eventually the person is going to die within few hours, not more than this.
Question relating to blood donors, and if you can be a blood donor.
Yeah, I don't see any problem unless you have some disease, and you are going to have contamination, contaminated to the others.
Okay. Following on from that, can you receive blood if your hemoglobin is not dangerously low, but slightly low?
Now I'm going to speak medically, not religiously, I say no. Because we have a lot of those unpleasant events, that some of these diseases, will be. And I'm going to tell you about this case, if we have time.
We have plenty of time. Yeah.
Okay, this happened to me even in Riyadh City. I was not the one who followed that physician, A man, and I think in his 50s or 60s, he came to the hospital with AIDS, which is unusual to have it in Saudi Arabia. And he's very righteous and pious person. And he died eventually after 3 or 4 months, I forgot. After a while, I forget how long was it, his wife came with AIDS. And apparently in some of her deliveries or whatever, she needed some blood transfusion, and it was given to her in the hospital by some Western people, or whatever, And this aid, subhanAllah, moved from her to her husband and showed up in the husband first, and died before it was diagnosed, from the woman herself, And that's why, such stories, we have some. Perhaps not too many, but we have some of these stories, and every once in a while you may discover some new disease coming. Now we have those protective measurements, for hepatitis, for AIDS, for other of those diseases that may be contaminated, by blood. But again, you have some diseases come, and to me myself, as the experiment, for this no coming disease, I don't like this idea. That's why I don't like to have blood transfusion for myself or for my relative unless it's a necessity.
Question here about the rights of a patient during child labour and delivery.
What rights we are speaking about? If this for anesthesia, for sure she has the full right to have anesthesia. Islam doesn't want you to be in pain. If these are the rights we are speaking about.
Right. I was wondering if there's any other topic that we haven't mentioned this evening that you have a passion for and would like to share with us.
Basically, I mentioned everything, I have, I'm too poor, in medical knowledge, that's why you may excuse me if I did not cope with you, and keep updated, with these matters, but inshallah, make dua, I'll be better, inshallah, next visit, if there's next visit,
There's a certain long-winded questions here. I'm sure if you can sort of put them in email format and pass them to Shaykh, they'll be answered in an individual basis. I felt some of these are potentially not applicable in terms of the audience, but if Shaykh would like to give dua.
Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Alhamdulillahi hamdan yuwafi ni'amahu wa yukafi mazidah. Ya Rabbana laka alhamdu kama yanbaghi li jalali wajhika wa 'azimi sultanik. سبحانك لا نحصي ثناء عليك أنت كما أثنيت على نفسك. نستغفرك ونتوب إليك. وأفضل الصلاة وأتم التسليم على سيد الأولين والآخرين سيدنا محمد الصادق الأمين المبعوث رحمة للعالمين وعلى آله وصحبه أجمعين. اللهم صل على سيدنا محمد وعلى آل سيدنا محمد كما صليت على سيدنا إبراهيم وعلى آل سيدنا إبراهيم. وبارك على سيدنا محمد وعلى آل سيدنا محمد كما باركت على سيدنا إبراهيم وعلى آل سيدنا إبراهيم في العالمين إنك حميد مجيد. بكل لحظة أبدا عدد خلقك ورضا نفسك وزنة عرشك ومداد كلماتك كلما ذكرك الذاكرون وطلعت فيه الغافلون. اللهم إنا نسألك من خير ما سألك من عبدك ونبيك سيدنا محمد صلى الله عليه وسلم ونعوذ بك من شر ما استعاذك منه عبدك ونبيك سيدنا محمد صلى الله عليه وسلم. نسألك الجنة وما قرب إليها من قول أو عمل ونعوذ بك من النار وما قرب إليها من قول أو عمل. اللهم أصلح أمة سيدنا محمد صلى الله عليه وسلم. اللهم فرج الكرب عن أمة سيدنا محمد صلى الله عليه وسلم. اللهم اجمع على الهدى أمر أمة سيدنا محمد صلى الله عليه وسلم. اللهم اغفر لأمة سيدنا محمد صلى الله عليه وسلم. اللهم ارحم أمة سيدنا محمد صلى الله عليه وسلم رحمة عامة. اللهم أعز أمة سيدنا محمد صلى الله عليه وسلم. اللهم انصر أمة سيدنا محمد صلى الله عليه وسلم. اللهم يا من لطفت في خلق السماوات والأرض ولطفت بالأجنة في بطون أمهاتها لطف بنا وبسائر المسلمين في قضائك وقدرك لطفا يليق بكرمك يا أرحم الراحمين. اللهم اجعل اجتماعنا هذا اجتماعا مرحوما وتفرقا من بعده تفرقا معصوما ولا تجعل فينا ولا منا ولا معنا ولا إلينا شقيا ولا مطرودا ولا محروما برحمتك يا أرحم الراحمين. اللهم يا مقلب القلوب والأبصار ثبت